If you have been accepted into the nursing program or will be transferring from the bridging year program, there is a checklist of clinical requirements you will need to complete before beginning your first year. This module will walk you through everything that you will need and things to expect. Your first point of contact will be the Executive Director of ANI, Lisa Purley-Dutcher, as well as the Administrative Assistant, Pam Weeb. Your acceptance letter and any additional documents such as the Criminal Record Check Form and Immunization Record Form will be sent to you by email. Please take a look at the Nursing UNB Handbook for a more detailed description of clinical requirements. Please note, all clinical requirements must be scanned and emailed to the nursing department sometime in mid-August. The date will change every year. Each new cohort of nursing applicants accepted into the program will be contacted with all updated information, so it is important to check emails frequently. Please keep in mind that failure to submit the completed clinical requirements before the deadline will result in deregistration from the clinical nursing courses. Timely submission of your clinical requirement documents is critical. Your first clinical requirement is the immunization record form. This will be emailed to you. You will need a completed immunization form so that the Faculty of Nursing can determine your ability to participate in patient-related activities during placements. You must have these records reviewed and updated by a healthcare provider. Take your previous and childhood immunization records with you to your doctor's appointment. If you do not have these, they can be obtained by contacting your local health center, school or doctor's office, or anywhere you may have completed your childhood immunizations. If you do not have a doctor, you can get an appointment to see a healthcare provider through a community health clinic or walk-in clinic. All sections of the immunization form must be completed, including specific dates and blood work results. Please note, plan your appointment with a healthcare professional several weeks in advance of the deadline, as some vaccines require several doses and blood work results can take up to 4 weeks to process. Documents filled out by a healthcare provider will not be automatically submitted to the Faculty of Nursing. It is your responsibility to obtain and submit these documents to crbn1@unb.ca. Immunizations you will be tested for are tuberculosis, hepatitis B, influenza, diphtheria, tetanus, and whooping cough, chickenpox, red measles, mumps, and rubella, as well as polio. Clinical requirement number 2, proof of current CPR certification, healthcare provider HCP with automated external defibrillator. Clinical requirement number 3, security criminal record check. This is a yearly requirement and must be completed between the months of June and August. Many clinical placements will involve working with vulnerable populations, and agencies are requesting that nursing students provide evidence of a current criminal record check. Clinical requirement number 4, applied suicide intervention skills training workshop. This is required before you can enter into the second year of the program. However, it is best to try and have it completed ASAP. Supplies required for clinical. Only red and black scrubs that must be purchased from the UNB bookstore. A stethoscope. If possible, try and get a quality one. Blood pressure cuffs, pediatric, adult, and oversize. Predominantly white or predominantly black sneakers, specifically and only for clinical. Leather is a good option as they breathe and are easy to clean. Nursing-specific scholarships. Inspire has bursaries specifically for Aboriginal students in the field of health and have 3 different deadlines throughout the year. The 50th Anniversary Scholarship. This is awarded to a First Nation student on Fredericton campus in the nursing program. Application for this is due April 15th of every year. This application also puts you into a pool of hundreds of other scholarships you may be eligible for through UNB. There is also the TD Canadian Nurses Foundation Scholarship for Aboriginal students, ranging from $1,500 to $5,000. The SRLC, the Student Resources and Learning Center, is a convenient place for nursing students to work on their assignments and projects, with access to computer stations and a printer. It consists of 20 computers, as well as scanners and photocopiers. New this year is a peer mentor office. They will meet with students upon request. Some of the items you can rent out at the SRLC are a video camera with laptop and DVD burner, 2 laptops, 2 digital voice recorders, 5 iPods, blood pressure cuffs, stethoscope, vision screening equipment, hearing screening equipment, scales, flip charts, glucometers, and glow lights. The Advanced Standing Program, ASP. This 2-year program offered at the Moncton site builds on students' previous university courses and required prerequisites. This program, designed for students with at least 60 credit hours of university experience, will provide students with an opportunity to complete their Bachelor of Nursing degree in 6 terms over the course of 2 years and write the National Council Leisure Examination, also known as the NCLEX, following program completion. For more information, contact Debbie Amaral